I'm kidding. We're talking a little bit about what's happening here with Men's Health today. We appreciate you being here. Let's talk for just a second. I think there are 3 types of people. Okay, I've got duct tape, crazy glue, and aspirin in my medicine cabinet.
Pretty much, right?
I'm not going unless I have to.
Right.
I have a problem and I go, and then there are those who just don't go at all. There's
Absolutely.
preventative medicine.
Absolutely.
And that's vital. Let's talk about that for health.
Yeah, so that's extremely important, and you touched on a little bit of that. That's that common misconception that, you know, the only time for me to go to the doctor is when I feel terrible or when there's something wrong or when I've got a bone sticking out of my arm or something like that. But you know, some of the most important visits are when you're feeling fine, when you're feeling well, when there's nothing wrong. You know, I like to think of it, and I kind of explain it to patients as kind of like you take care of your car at home. You know, you don't wait for your engine to blow up before you go in and change the oil. You know, there are preventative things that you do along the way that keep that car running stronger, longer, and your body's a lot the same way. So. And
when I visit you at the doctor's office for the very first time, I fill out a booklet about my family health, and that's vital for you to find out that as well.
Absolutely. Family health, kind of your family history is very important. You know, getting in for those early visits to take the time to do that when there's not an emergency is extremely important as well. That's when we get to dive in deep and find the early things like high blood pressure, high cholesterol, diabetes, that can lead to heart attacks, strokes. It's when we can do the cancer screening. It's when we can, you know, check for things like that and stop them before they become something more serious. So, you know, usually the best time to come to the doctor is when you're feeling fine, when you usually don't feel like you need to go to the doctor. So.
And is 50 the magic number?
So I would say no. I mean, I think, you know, even 20s, 30s. I mean, I think preventative care visits are very important then. You know, especially nowadays with, you know, with the obesity epidemics and with diabetes becoming an earlier and earlier thing. It's more important for people to get in there early, and those are the times when, you know, the body starts the changes that lead to the heart attacks, that lead to the strokes later on. So it's very important to get in there in your 20s and 30s and just, you know, come in and say hi, meet us. You know, we're not that bad.
Very much like going to the dentist, right?
Exactly.
Going every so often, kind of get into the routine, and it's not that, take the fear factor out of that as
Absolutely.
well. All right, doctor, thank you very much for your time. We appreciate it.
Thank you very much. Appreciate it.
All right.